it does mean is that just because Sadie and I are here talking to you today does not mean that your day stops or that you don't need to see clients. So if you need to take that phone call and need to talk to that person, go ahead and do so. Check us out on YouTube after the fact. Selling off the scope of appointment. So when we say there's a couple, I think what they're known now in the 21st century as our trigger words, things that trigger people. And scope of appointments are easily one of the most triggering things for insurance agents who write in the senior market. And that's because, I mean, by design, they're kind of a speed bump to a sales process. And so what we want to do is, because scope of appointments, it's been talked about now for the last 5 years of organizations trying to get rid of the scope of appointment. And do I think it's going to happen? I do. I do think scope of appointments are going to go away in the next 5 years, but I also was saying that about 5 years ago. Sure. So I'm kind of now in the camp of, instead of like, let's stop praying to the insurance gods that scope of appointments are going away, let's start learning how to deal and how to work with the scope of appointment in your sales process to help you make more sales. And ironically enough, scopes of appointments tend to be some of the best cross-selling tools. So again, I understand the real world, they can be a speed bump, but let's go ahead and change our mindset. First and foremost, how do you get a scope of appointment? We'll talk about this. I do highly recommend you talk about the AEP toolkit with a SMS or senior marketing specialist representative. But make sure if you have at least one contract with senior marketing specialist, you have access to the AEP toolkit.
Yes, there is a generic scope of appointment form in there. If you click on the toolkit, it's like the second tab down. It says SOA forms and CMS resources, something like that. We have a generic scope of appointment in there. But also keep in mind that carriers have their own scope of appointments as well. I think some of them like to be picky and say you have to use our scope of appointment, but I think CMS says a scope of appointment is a scope of appointment. But if you just want to completely avoid that altogether, you can use that generic scope of appointment that's in our toolkit, and super easy to find.
You also have access to a electronic scope of appointment, either by email or even text message on Medicare Center. Allows all the same options, work the exact same way. But if you're not face-to-face with the client, which is something we saw a lot of in 2020, we'll see a lot again 2021, is those the non-face-to-face appointments. Medicare Center is going to help you accommodate that. AEP Toolkit, just call our office and get a full tour of it. There's also, again, we don't have the time today to go over everything's in there, but there's marketing pieces, compliance guidelines. We have something called in there, cover the CYA forms, the cover your assets forms, where kind of make sure it helps you, guides you to do a compliant Medicare Advantage appointment. So all that being said, this is what a scope of appointment looks like. It's the same platform as kind of what you'll see if it's electronic or a paper scope. But essentially what in addition to talking about those core Medicare products, the scope of appointment clearly lines out where it says dental, vision, hearing, and a hospital indemnity product. So whenever I say like use the scope of advantage to your appointment, I always say like, hey guys, like with talking to my client, this is the government suggesting we talk about these products. This isn't me pushing product. This isn't me trying to make an extra sale and get one over on you, Mr. or Mrs. Client. This is something that like, hey, if we're going to talk about these options, the government is insisting we also talk about these other options. So that's why we focus on DVH and hospital indemnity.
Yes, it is a perfect excuse to bring it up. The client's not going to think anything of it because they have to sign off whether they want to talk about it or not. And then also keep in mind that people love they love what they can expect.
Yeah.
So if you're mentioning that at the beginning of the appointment, they're not going to be surprised, and they're not going to feel like you're pushing a product on them or trying to sell them something.
Opening up a trench coat, like want to buy a policy.
Yes,
like,
exactly.
No, we talked about this.
Yes. So if you mention it first off at the beginning of the appointment, it's going to feel a lot more natural and make more sense at the end whenever you're trying to bring that up as well, because they have to sign off of it in the first place.
And then again, all the other plans, things that we always preach about, talking about cancer, hospital, cancer, home health care, final expense, long-term care, those we recommend, especially obviously long-term care, final expense, that's a hard rule. But the other ones we do recommend not bringing up in a Medicare Advantage or prescription drug plan appointment. The way that it's worded, if you look at the MCMAG, the Medicare Communication Guidelines, what it comes down to is you can't talk about financial related products. Financial being a final expense, life insurance, long-term care, which is asset protection. So it does explicitly talk about those. It doesn't explicitly talk about cancer or home health care. Mike has talked about this, and I tend to agree with him that I don't want to be the person that the carrier or CMS makes the example of. So if it's not, we follow the guidelines, we're always going to err on the side of compliance. If it's not on the scope of appointment, don't talk about it. But there is a reason to always set up, again, not the day to talk about it, but since I'm on my soapbox, here we go, always setting up a follow-up appointment. Even if you're meeting with somebody October 15th, set a follow-up appointment for February. Again, helps protect against the open enrollment period, helps you with engaging with your client, and it allows you an opportunity to bring up some of these extra products.
Yes, one more point of contact.
Exactly. So let's go ahead, and we're talking specifically about hospital indemnity plans today. We'd love to hear from the audience here. Tell me your experience with hospital indemnity. Do you know what it is? If you don't know what a hospital indemnity plan is, we'll spend some time going over what it is and how it works. So I'd love to know kind of what your experience is with it. But when it comes to hospital indemnity, I think there's kind of, it comes to with your both clients, like a cancer policy. A cancer policy goes to everybody no matter what. You always bring up cancer.
Right.
What about a hospital indemnity plan?
So hospital indemnity plans are actually designed with Medicare Advantage plans in mind. So we'll get to Medicare Advantage in just a second, but Medicare supplements, the reason why we say maybe you need a hospital indemnity plan is just because it's not going to have those gaps that Medicare Advantage has, that hospital indemnity plans are designed to fill. So you might need one with your Medicare Advantage clients, and that really comes from you can kind of find that out what they want in that fact-finding process, which we will talk about, I think, a little bit later here in this presentation. But if it's just something that if you know your clients want that extra security, then bring it up with them. But Medicare Advantage clients, every single Medicare Advantage client should be offered in a hospital. Oh my gosh, a hospital.
It's a Thursday afternoon. You were warned. If you're still here, this is your fault. Thursday afternoon. Okay.
Medicare Advantage clients should always be offered hospital indemnity plans, just because there are going to be holes, there are going to be gaps that they are going to be held reliable for if they stay the night over and if they stay overnight in a hospital.
And that's what we talk about with Medicare supplements. Just a couple examples of when does it come in play. Sadie did a beautiful job explaining, like, you just got to find out what's important to the client. Keep in mind, an indemnity plan means that the money is given to the client. So if the client is worried about having extra money to pay other bills outside of just medical bills, or if they want extra income in the event that they end up in the hospital, Medicare supplement is a great pair for that. Also, things like observation care sometimes can easily get missed with Medicare supplements, and the maintenance medications, things like taking a Tylenol. There's like 50 cents a pill at your house. At a doctor's office, I actually have a picture of like a Hall's cough drop costing somebody $10. That's not Part D. That's not Part B. That's not Part A. That's something that comes out of pocket. So you do, even on a Medicare supplement, can still have some of those expenses that a hospital indemnity plan can bring up. So that's why when we talk about with these hospital indemnity plans, this is how, again, this is something that Mike's talked about in the past. This is a great way of using a scope of appointment to transition into a hospital indemnity sale. Now, what I always do is I always focus on how do you explain a scope of appointment to a client, because that's something to keep in mind, especially if it's somebody who's brand new to you. Maybe they're a lead, maybe they're, not even a referral, like they don't know you from Adam. You call them on the phone, you're at their house, so the case may be. People can get pretty apprehensive to sign their name on a paper for somebody that they don't know. Even something as simple as signing their signature or putting their signature on something requires a certain level of trust. So make sure that when you're explaining what the scope of appointment is, again, what I always say is, we're going to be talking about government-sponsored plans. We're going to be talking about Medicare Advantage and prescription drug plans. Because we're going to be talking about government-sponsored plans, I just need to be able to prove that you gave me permission to do this. This is to protect you, the client, so that an agent who doesn't ask for this is trying to fly under the radar. So this is allowing you protection to show that you're working with and have a proof that we had this conversation. It's protection for me to say that I'm doing the right thing and following rules and regulations. So that's an easy way to bring up why the scope of appointment is easy. And then as an easy transition, we have it here, just so you know, Medicare Advantage plans will leave you responsible for the hospital co-pays and 100% out-of-pocket costs for observation care. Again, we do have a hospital indemnity options that we can look over shortly. There's one thing I would change about that sentence. Do you have any idea what it would be? I'm putting you on the spot. It's because it's very picky. I'm very picky about this. Be careful when especially when you're talking about things like scope of appointments, you're talking about government forms. Be very careful that you don't use jargon. So when you saw, even though it's mentioned hospital indemnity on the scope of appointment form, when you're talking about that, make sure you don't call it, nobody knows what an indemnity plan is outside of insurance.
Okay.
We use the word hospital benefit. You speak their language. The more complicated you make it seem, the more complicated you're going to get a yes.
Okay.
So I don't like to, when I'm talking about this with a client, I don't like to use the word indemnity because they don't know what it means. I use benefit.
Darn, who made these slides?
Was it you?
Not. It was.
What? Yeah, I was like, for a second, I was like, wait, who did make these slides? So moving on here, again, this is how it does help when you're using the scope of appointment to cross-sell. It does help to explain to a person why the scope of appointment is a necessary step in this process and how to use it in order to make that cross-sell. So I love this. Why did I close my nose? There's kind of two ways that we see selling a hospital indemnity plan work. And I honestly think it's a 1-2 step. It's you start in the fact-finding portion. Fact-finding, 95% of all cross-selling is effectively done in the fact-finding portion of your appointment. So that's kind of like the first step in that.
Mm-hmm.
And again, Sadie put it here beautifully. Who do you have your hospital benefit through?
It's just a super easy is intrusive the word I'm looking for?
Yeah.
It's just an easy way that you can bring it up and it starts the conversation. You're talking to them, you're fact finding, you're finding out what's important, and then just simply bring up, who do you have your hospital benefit through? Well, I don't. All right, that's really important to know. Let's talk about that, or let's hold on to that and talk about it later. It's just a very easy phrase to bring up and just kind of slip into that fact-finding process.
And it brings up, it's an open-ended question. It's not asking, do you want to talk about a hospital benefit? It's saying, well, who is it? You're assuming. When you assume, like, well, who's it through? In their mind, it's like, oh, I should have had that. If you assume that I have that and I don't have that, that's scary.
Yeah.
It's really easy. This is great, especially whenever maybe you're talking to a Medicare Advantage client that doesn't have an election, or you're talking to somebody, who you really can't help until AEP rolls around. You sit down and talk with them and you ask them that question, who do you have that hospital benefit through? They'll say, oh, well, I showed you, this is my United Healthcare health card, or this is my, Humana insurance card. Like, well, no, that's your insurance. But that extra hospital benefit, what do you have that helps you pay those co-pays? And well, I don't have it. Your agent didn't. Are you okay? I mean, $350 a night's kind of a lot. Are you okay with having to come up with those funds? Another easy question, question you can ask in your fact-finding process is asking, if you go to the hospital, what funds do you have set aside for that visit? And you have to make it very specific to them. If you go to the hospital, what's your plan? Go ahead, let's talk this out. If you go to the hospital, tell me your plan for coming up with those hospital funds. Really easy to do that. But again, making sure that we're speaking their language, we're using the word indemnity, or we're not using the word indemnity, we're using the word benefits as well. Brian asked an actual question. Good for you, Brian. He said, does senior marketing specialist have any super cool handouts that show typical hospital costs and how the hospital indemnity plan applies? So we don't have one that shows like, here are the average costs, or here's how a hospital indemnity plan works. I will say there's a really cool video offered by GTL, which we'll talk about more in a little bit. GTL has great consumer facing videos that agents can use that kind of describe how a hospital indemnity plan works. We can't do anything more specific than that, because when you create a piece yourself that has plan specific information on there, it's not compliant, because you're using somebody else's information using somebody else's logo, someone else's name without their permission. So we can't create anything specific to a certain carrier, but GTL does have a really cool video that you can utilize. So that's one way, again, during the fact-finding appointment or portion of it. What this does, a good fact-finding portion of your appointment, what that will do, it sets the expectations even more that you're going to be talking about that. The way that I was taught many years ago about selling a hospital indemnity policy was actually just incorporating it into your Medicare Advantage sale, because they are designed to be hand in hand. So you present it hand in hand. And so we all know whenever you're making a Medicare Advantage sale, you have to go through those summary. In order for it to be compliant, you have to go through that summary of benefits. So showing them again, and the way that it was, you're going through, all right, Sadie, so here's your United Healthcare plan. If you go into the hospital, you're going to have a $250 copay. Now, don't worry about that. If that makes you a little uncomfortable, I have something that we can help, pay that copay for you. Now, if you go into the hospital and you end up having to go into this observation care, that's going to be 100% out of pocket for you. You're going to have to pay for that. But again, remind me at the end of this, I'll let you know, I have something that'll offset that. Sadie, if you end up staying in the hospital and you have this copay, the first 4 nights that you're there, you have a $250 a day copay. Again, just say, I have to say it, I take care of you holistically. If you don't like that, I have something that can help offset that cost. You keep doing that throughout the Medicare Advantage sale, talking and alluding to the hospital indemnity plan. By the end of that presentation, you don't even have to bring it up. They'll be like, okay, so here's all that, but wait, you told me you had something to take care of that. Let's go ahead and have that conversation. It just, the two, it's such a beautiful marriage between hospital indemnity and Medicare Advantage that you can't do it better than that.
It's literally designed that way. Like, it's not a coincidence. These plans are literally made to be paired with Medicare Advantage plans. So, yes.
So any questions about that? One thing I will mention, it's kind of, I love simplicity when it comes to any type of product, but specifically ancillary products. That's one thing that is both a blessing and a curse with these hospital indemnity plans. These hospital indemnity plans are by far, in my opinion, some of the most versatile, most personalized, most customizable plans, which are great because you make the client feel like you're building them their own little comprehensive package. Like you are building and building something specifically for them. It has their name on it. It is their plan. Really helps with the stickiness of that policy. However, on the other side of that, the more customizable something is, the more complicated it can be seen. So these riders are both, it's a double-edged sword. I guess is what I have to say about that.
For sure. There are a lot of options, but also remember, they're riders, so they're all optional. A few that we really like that don't really take too much convincing, I guess, or it's easy to see the need, are things like ambulance services. Everyone knows in America it's expensive to take an ambulance ride. Some people would rather just crawl their way to a hospital to get an ambulance.
But that's actually a really good point, is that there's been so many incidences where people don't make it to the hospital because they're so hesitant to call 911. They're so hesitant to get an ambulance ride. So wouldn't that be nice peace of mind? You're talking to a spouse or a husband and wife duo and saying like, hey, you're going to be much more likely to get the help you need faster. You'll have less hesitation to do so. Like, this could save your life.
Yes. And since it's already included in that plan, it feels a little less, I guess, invasive or salesy, I guess, again, because this is just a little thing that you can tack on to the hospital indemnity. That's how riders work. But there's some really great benefits, especially, we'll have to mention GTL. Now, your comment earlier about compliance and what we can do, now I'm just scared.
Well, okay, so compliance is more geared towards what do you tell a beneficiary versus what you tell an agent. So we can drop some secrets.
Okay.
We can drop some secrets.
We took a screenshot of the GTL, but if you're interested, we won't talk too much about it, but if you're interested, we really like the GTL hospital indemnity plan. We really like GTL for all ancillary products. That's one that we suggest, but GTL, if you want to look up some examples of some really cool riders and whatnot, we have a few listed on here, but yes, we do love GTL.
And if you want some more little secret snacks about GTL, GTL is actually getting ready to launch in several states a new hospital indemnity plan called GTL Elite. And we looked at it and I was like, wait, so it adds a ton of benefits, has shorter observation or shorter waiting periods, has less underwriting, but yet it's still cheaper. So it's gonna be a big deal. If for those of you who have clients who are already on GTL, those clients will automatically be moved to the GTL Elite, so they will be getting more benefits without having to go through underwriting. So GTL is always kind of being like, they're one of our top go-to carriers. That's why we mention them here on there. They're tried, they're true, they're trusted. Never had issues with what's the word whenever you submit a claim? Never had issues with claims with them, which is why we do what we do, is for, you know, when they need it. They're just an incredible organization. So make sure you ask about GTL, but we will be working very closely with GTL going to AEP because of their new GTL Elite plan launching September 1st in a lot of different states.
Yes.
So, okay. So again, that's kind of what we talk about. Here is my tip. When it comes to, and I say my tip, what senior marketing specialist recommends when it comes to offering a Medicare Advantage plan is a traditional sales tactic. You do the good, the better, and the best. And automatically looking at this, you all know it, people tend to go to that middle of the route option. They don't feel like they need to spend the money on the best of the best, but they also want better than, you know, the McDonald's version of coverage. So it's very careful. You guys be very careful about how you present the plan. Talking about just a standard Medicare Advantage plan, you let them know, hey, this is Medicare cover or medical coverage with full hospital stay copays. And I like that verbiage. Mike came up with that full, you have full copays. And just let them know that, like, it really kind of sets that message of, like, you get no help. You are fully responsible for those copays. At this point, I do like to remind clients that even if, because a lot of times these plans are $0 premiums, so I do like to remind my clients that they do have that Part B premium they still have to pay, because for whatever reason, even if like free is the lesser option, which free typically is the lesser option, when things are free, people associate that with no risk.
Yeah.
So they're like, well, I'm not paying for it. So like, yeah, it's fine. Like, go ahead. I'll just stick with that one because it's free. I'll just take it. So remind them, even though if their premium is $0 on that Medicare Advantage plan, remind them that they are still paying some sort of premium for medical services, that being their Part B premium. The second being Medicare Advantage with a hospital and benefits, so medical coverage with some or all of the cost paid for when it comes to inpatient care. And then the last option being that hospital indemnity plan with a cancer rider or with a short-term care rider. Again, a good, better, best option. You'll get some that pick each one, but you'll see overwhelmingly the majority of people go towards that middle option, which is of course the hospital indemnity cross-sell.
It also just it puts all of everything that you talked about throughout, all the things that you educated them on, it kind of puts all of those perspectives right next to each other, so they can also keep that in mind if they want to change it later. It's that's 100%.
And then just keeping in mind too, I have something right down here, but it's also really important on your close, on your trial close. We talk about the 8-step selling process. The trial close is kind of where you make your recommendation. If you were a doctor, if you were to give somebody your medical opinion, that's where this comes in here. So a lot of people, me would say, you know, based on your situation, based on your lifestyle, based on our conversation, I would recommend that you go with a Medicare Advantage plan and a hospital indemnity benefit with your Medicare Advantage and a hospital benefit to round out, again, to make sure that you have a customized plan to you. So it comes together in my recommendation. I'm pre-bundling it for them. Also, keep in mind that CSG's quote engine that you have access to through Senior Marketing Specialist, or if you're an Integrity Partner, you have it through Medicare Center, has a what they call Fill the Gaps option, which allows you to pull up a Medicare Advantage plan, and then it pulls up a hospital indemnity plan. So where you customize it, say, oh, you have a $250 copay here, let me give you a $300 a day hospital benefit, and it lines them up so it literally makes the sale for you. So if they have two options at that point, if the client says, yes, you know what, a hospital indemnity sounds great, you're the smartest person I ever met, thank God I found you, go get the app, get the voided check, move on. My recommendation, again, utilizing e-applications, especially whenever, that way it kind of bundles it. When you have to fill out multiple paper applications, kind of ruins the illusion of a bundle.
Yeah.
So utilizing e-applications, I think, is a huge point here. And on the no, I'll pass. I know some sales strategies say like you have to ask 6 times before you get to the yes, but I also understand you don't want to ruin a relationship to try to get a hospital indemnity sale. So I can make an argument for either way to go for there. The idea here is that you let them know it's an option, give them the decision, and if they say no, that's their decision. Ask them next time though. Every time you sit down with them, like, hey man, I know we talked about this last time, but at that follow-up appointment, I know we talked about this last time, man, but I wouldn't be doing my job if we didn't point out, like, you have some significant risks still here.
Yeah. And then also, I think it kind of says it in there. If they say no, okay, great. If anything changes, let me know. Leave them with that, I'm the person to go to. If anything ever changes on anything, I'm happy to take care of you. So that way they know that it's not a problem. Well, one, it's not a problem that's going to go away. So if something changes, let me know. But then also letting them know that you are their person for all of the things and to go to you if something changes.
And that's just it. We had it on here, like you can add this coverage at any time. However, you still have to make that person uncomfortable with their situation. So careful about saying like, hey, you can add a med hospital indemnity plan at any time. We can talk about this next time. I always like to say like situations change. If you end up getting a diagnosis or if you end up in the hospital between this appointment and our next, I can't help you. You're healthy now. GTL allows you to be guarantee issue from 64.5 to 65.5. So you're in the right time frame. You're healthy right now. I can get you this coverage. The next time we talk, your situation may be different, and I can't guarantee we can get you this plan. So you still, again, just reminding them and really educating them on what that risk looks like without being overwhelming and really coming across pushing. At the end of the day, I don't want to see us as salespeople. We're advisors. And if you're truly advising them on the risk, allowing them to be uncomfortable, it's their decision to decide how uncomfortable they are with their risk. You just have to let them know what the risks are. All right. So just, again, some ideas, something I know Mike talked about this as well in the DVH webinar they had on Tuesday. When it comes to hospital indemnity plans, which one should you offer? Pick one. Pick one carrier. I know there's Medico has one, Aetna has one, GTL has one, Heartland has one. Tons of carriers are coming out with hospital indemnity plans. Pick one carrier. Shop benefits, don't shop plans. Okay, so don't offer your clients 3 different carriers. Offer them one carrier, 3 different plan options, kind of like what we talked about. Get comfortable with it. Another thing that Mike always says is quote high, basically knowing that like, hey, I'm pretty certain that just off the top of my head, this plan's going to be like $30 a month. Say, yeah, it'll be around $35 to $40 a month. That way, when you actually quote it and it's only 30, you seem like you're saving them money without really doing anything different. It's a much different situation if you say, oh, I think it's gonna be $30 a month and it ends up being like even 33 or 34. You've already set them on a price. Anything more than that seems like it's going to be more expensive. So making sure that quote high, estimate high.
Yes.
And then last but not least, reminder, I remember I guess this happened in 2014. 2014 is when CMS said that no business can be paid on Medicare Advantage business during AEP. You have to wait until after October 1. And we always joke that CMS stole Christmas. So if you don't want, because you're not making an income the last quarter of the year, and you have Thanksgiving, you have Halloween, and girl, you have Christmas.
Yeah.
So if you want to make sure that CMS does not steal Christmas from you, writing these ancillary benefits will give you an income during that time of year when you're working the hardest and just not seeing the fruits of your labor. So can definitely be an asset to help you buy that train set for your mom.
Now keep in mind these things, these ancillary products, and we kind of talked about this on Tuesday, they're not going to make you a millionaire. But if you sell a hospital indemnity plan with every or most of your Medicare Advantage plans from the year before, I mean,
retention. Retention's a big one.
Exactly.
More policies a person has with you, the more we talk about having sticky clients. Having more than one policy with you dramatically increases their loyalty with you. And like you said, it is income. They pay great commissions on that. We don't talk commissions on these, talk commission specifics because they're different state to state. Talk to our outreach team. They'll be more than happy to talk to you about what the commissions can look like for you as well. And again, it's during Christmas.
Yeah.
Buy that train set. Next steps, get contracted. Talk with us about hospital indemnity plans. Make sure if you have a hospital, if you know you have GTL or you know you have Aetna or some of these other carriers, but you don't know who your upline is, that's kind of a problem. If you don't know who your upline is, it means they're not doing enough for you. Make sure you talk to us. Ask us about our Q4 co-op program that we're doing to help people and help to get them to where they want to be in Q4 going into AEP. Review apps, brochures. Making a hospital indemnity sale is about a 20-second process. If it's going over an app, it's asking the questions. Do you want to have coverage for if you go in the hospital? And again, start offering. Get uncomfortable. Get uncomfortable.
Get uncomfy.
Just do it.
Yeah.
If you wait, the biggest death of a sales agent I've seen is that agents that feel like they want to know everything before they start offering it. You will never know everything.
Yep.
So if you wait until that happens, then you're going to go hungry. So make sure you get uncomfortable, start that sales process, rely on senior marketing specialists, our live chat feature, or give us a call. If you get stuck on something, we're here to help you before, during, and after that sale.
Yes, the follow-up calls that you're going to get after this webinar, either tomorrow or Monday, who knows. That's a great time to bring up hospital indemnity and make sure that you have the right contract, the best product that you want to be working with in your area.
On that, again, we talked about it a little bit earlier today, but the AEP toolkit, guys, these are just some pieces that you get. They're marketing that says you can send it to your current book of business and say, based on our review, I think you need to stay put. By the way, check out this hospital indemnity stuff. Or based on our review, we know what looks like we need to meet. Let's go ahead. Here's some information about hospital indemnity beforehand. Customizable, put your name, logo, headshot, agency information. You will already have this, and it's both free. Just go on smsteam.net, click AEP Toolkit, make sure you have at least one contract with us, and all of this is yours.
Yes.
Any questions, comments, concerns, sets, or promises, guys, please let us know. If you're looking in for some more in-depth hospital indemnity training, make sure you go to smsteam.net, click on the training tab. We have a specific products training. We have a lot going on for hospital indemnity. But hospital indemnity, I have two favorite products, cancer insurance and hospital indemnity. And hospital indemnity is by far the easiest sell.
Yes. If you also want to take a look at specific plans, just kind of on your own, look at the brochures. We have those on our website as well. You can go to products, just make sure that you're signed in to our website, and you can take a look at different products in different states, because of course they're going to vary state by state. So.
And again, 9-1 guys, GTL is coming in with that elite plan. So if you haven't heard of it, review it, call our office, talk about it. It's looking like, again, GTL has always been my favorite hospital indemnity. I'll say it. Maybe I shouldn't. I'll say it. They're my favorite. And these changes that they're making are very nice.
Yes.
Brian, a very great question he asked. Wanted to know any good sleeper picks for his fantasy football draft. Brian, my recommendation is to get as many kickers as possible. Your first pick, get a kicker. Every time. Get as many kickers as you can.
Helpful.
So perfect.
That's great. Also, we have a few more, I guess kind of one more month left of lots of webinars, lots of events, lots of trainings going on. If you've heard us talking about our AEP bootcamp, we are full. So